The most dangerous illnesses are those that don't announce themselves with fanfare. They whisper, quietly, patiently, until they're too loud to ignore. Prostate cancer is one of the leading causes of cancer-related death in men, yet it's also one of the most treatable, if caught early. The problem? It rarely shows up with dramatic symptoms in the beginning. It creeps in silently, often mimicking normal signs of aging or minor health issues that men tend to shrug off. That's why awareness is everything. These subtle signs could be your only chance to catch it before it becomes life-threatening. So let's break it down, the 12 silent signs of prostate cancer most men ignore and why you shouldn't. 1. Frequent urination, especially at night, nocturia. You're waking up more often in the middle of the night to pee. Once a night becomes 2, then 3. It's disruptive, frustrating, and easy to blame on drinking too much water before bed. But here's the catch. Frequent urination is often one of the first signs of prostate enlargement or obstruction, especially when it's paired with nighttime waking. When the prostate begins to swell, even due to non-cancerous causes, it presses against the urethra, making your bladder work harder. If this becomes your new normal, it's time to speak up. 2. A weak or interrupted urine stream. Notice you're not urinating with the same pressure as before, or you start again. That's not just getting older. A weak or intermittent flow suggests obstruction of the urethra, the narrow tube that runs through the prostate. If a tumor is growing even slowly, it can interfere with this function long before any pain arises. 3. Burning or pain during urination. Pain or a burning sensation during urination is typically associated with infections, but in the absence of infection, it's a potential warning sign of inflammation or malignancy in the prostate or urethra, especially if it persists, worsens, or doesn't respond to antibiotics. Don't ignore it. 4. Blood in urine or semen, hematuria or hematospermia. This one might only happen once. A faint red tinge, a single drop, easy to disregard, but any blood in urine or semen is never normal. While it could be caused by an infection, trauma, or benign conditions, it's also a classic warning sign of cancer in the urinary or reproductive tract. If it happens even once, get it checked. 5. Erectile dysfunction, ED. Men tend to hide or silently suffer with ED due to stigma, pride, or embarrassment. But sudden or worsening erectile dysfunction, especially when paired with urinary issues, can be a sign that the prostate is affecting nerve pathways or blood flow. It may not be just stress, after all. 6. Pain during ejaculation. Discomfort during ejaculation is rarely talked about, but should never be ignored. It may indicate inflammation, pressure, or growths in the prostate gland. It's your body trying to warn you that something's not functioning as it should. 7. Persistent pelvic, lower back, or hip pain. Pain deep in the pelvis, lower back, or hips is often brushed off as muscle strain or aging, but when it's dull, persistent, and doesn't go away, it may signal the cancer has spread beyond the prostate, especially to the bones. Bone metastases are common in advanced prostate cancer, and they're often misdiagnosed as orthopedic issues in early stages. 8. Unexplained weight loss. Weight dropping off without changes to your diet or exercise? That's a big red flag. Involuntary weight loss can be one of the earliest systemic symptoms of cancer. When the body is fighting something internally, metabolism shifts dramatically. Don't wait to see if it comes back. 9. Chronic fatigue and low energy. There's tired, and then there's that bone-deep exhaustion that sleep doesn't fix. When your body is fighting a hidden illness like cancer, it diverts energy to where it's needed most, leaving you depleted. Prostate cancer can cause fatigue even before it spreads, due to inflammation, hormonal changes, or blood loss, especially if paired with anemia. 10. Swelling in the legs or feet, lymphedema. Swelling in the lower limbs may be caused by blockage of the lymphatic system, especially if lymph nodes in the pelvic region are affected. It may also result from tumor pressure on blood vessels, leading to fluid accumulation. If the swelling is persistent or occurs alongside pelvic discomfort, it's time to dig deeper. 11. Urinary incontinence or dribbling. Do you find yourself leaking urine when you laugh, cough, or after urinating, or needing to run to the bathroom more often with urgency? Incontinence is often linked to nerve disruption or prostate enlargement, which can be caused by cancer as well as benign conditions. Either way, it's a sign you need medical attention. 12. Mental fog, depression, or sudden mood changes. Here's one most people don't talk about. When hormones are out of balance, like testosterone being disrupted by prostate issues, it can trigger mental and emotional shifts. Brain fog, mood swings, even mild depression. Your prostate doesn't just affect your plumbing, it's tied into your entire endocrine system. Why these silent signs matter? By the time prostate cancer produces obvious symptoms, it may have already progressed. That's why these early, quiet indicators are so crucial. They're your chance to act before it's too late. Men are often taught to tough it out or not complain. But being silent about your health doesn't make you strong. It makes you vulnerable. What you should do next: get screened. A PSA blood test and digital rectal exam, DRE, are simple, fast, and potentially life-saving. Start early if you have risk factors. African American men and men with a family history should consider screening at age 40. Most others should start by age 50. Live a prevention lifestyle. Whole foods, regular movement, and managing stress go a long way in reducing risk. Listen to your body. Subtle changes matter. Don't wait for pain. Final word: don't be the guy who waits too long. Cancer doesn't care how tough you are. It doesn't care how busy you are. It doesn't care if you're scared. But you should care, because you only get one life. If your body is whispering, listen now, before the whisper turns into a scream.